It's not uncommon that I see patients in the rooms that tell me they've come to see me because, for instance, they need a lesion removed from the face and they say, I don't want to have a scar. So it's important to realise that with scar or scarring, it's a complex process, and the skin is made of two layers in general, the epidermis and the dermis, which is the thicker structural component of the skin that cannot be cut without leaving a scar. That's how dermis heals. So you cannot do a full thickness skin excision of any kind or even an incision without leaving a scar. But what you can control to some degree is the quality of the scar and how it heals. So with certain patients there's a propensity towards bad scarring, and a lot of that is genetic. There's also different areas of the body that are prone to poor scarring, such as the ears, the chest and the outside of the arms. Other areas of the body tend to heal incredibly well, leaving almost no scars, such as the upper eyelids, which is why blepharoplasty or lid lift scars are usually almost imperceptible. So age influences scarring as well, so older people tend to have better scars, less inflammatory response to healing. And the other thing which we can control are surgical techniques. So plastic surgeons often use multiple layers of stitches to support the wound as it heals and to brace it, and tend to use smaller, finer stitches in a lot of cases. Things such as issues with blood supply, tension on the wound, infection, they can lead to poor scarring. And then when you do get a nasty scar, which is rare, but if that happens, it can be either a hypertrophic scar, which is where there's a thick, raised, red, itchy scar, or in severe case you can get keloid scarring, which is when the scar tends to grow almost like a benign tumour. It's a disorganised mass of collagen and fibres which are growing outside of the line of the original scar. So you may have seen some has an ear piercing, a small piercing, and then they have a large massive scar, large lump there, and that's a keloid scar. And they can be very difficult to treat and often require a multimodal approach such as surgery, pressure therapy and steroids. So scarring is a spectrum, and our goal is always to leave you the best quality scar we possibly can.